Carla. I'm going to be your nurse today.
Hi, Carla.
And hygiene. Can you state your name and date of birth, please?
My name is Rachel Albert. My birth date is 10/9/94.
Okay, cool. Can I see your wristband? Alright. Well, Rachel, I'm here to do a quick, integrated assessment. Okay?
Okay.
Head to toe. I'm going to put some gloves on. Now, Rachel, do you have any allergies I should know of?
I am allergic to shellfish.
Okay.
Which has iodine in it, so potentially yes.
Okay. Well, no iodine or shellfish. Although that sucks for you.
Awesome. That was rude.
Too much. Okay. Can you pass the notes, please? Okay. Now, Rachel, do you have any pain?
Not today.
Not today.
Feeling good.
Good. Okay. Alright, I went ahead and closed the door for privacy, okay? Because we're going to do a pretty lengthy physical assessment, okay?
Okay.
Now, I would be noticing her appearance just by the little small conversation we just had. She's alert, and with it for the most part. Her just overall kind of look, she has good color, not sweating, skin's intact from what I can tell. Now, at this point, I would collect vital signs. Since we don't have the equipment here, well, I'm just going to say that I would have taken temperature, blood pressure, pulse ox, what's the other one? Respirations, and pulse. I would also check her height and weight. Alright. Now, real quick, I just want to test your eyes, okay?
Okay.
Can you tell me how many fingers I'm holding?
2, 3, 4, 3.
Alright. Cool. Okay. Now, patient is conscious. Now I would check like facial expressions. Now, can you smile for me? Can you frown? Okay. Cool. I would assess or observe mood, feelings, expressions, their speech. She can show emotion. Perfect smile. Now, do you know where you are?
I'm in the hospital.
Okay. Do you know what time it is?
It's 11/12, somewhere around there.
Do you know the date?
It is March 12th, 2019.
Okay. Alright. So I would be assessing the skin for any color variations, variations in texture, temperature, turgor, edema, and lesions. So from what I can tell, there's no edema. Okay. I would also check for capillary refill right here, and it is less than 2 seconds. Cool. Can I see this hand? Perfect. Alright. I would have also inspected for nail shape. They're normal, not pitted. They have a normal 100-degree angle. Well manicured. I like this color. In a patient who didn't have their nails painted, they would have the half moon. They would be pink. Can't tell, but you know. All right. check for sites, any IVs, wounds, lesions, and I would state the characteristics of each. I would also check for pressure points. That's like the shoulder blades, the shoulders, elbows, hips, back of the head, heels. Okay. Alright, so up at the head, I would inspect and palpate the head, and I would state like consistency and distribution of the hair. You have hair.
Thank you.
It's brown. I'm palpating. Yes, okay. Black hair. I would also observe for symmetry, features, expressions, condition of the skin. So face is symmetrical. Can you smile? Yeah, symmetrical and everything. Can you show me your teeth? Can you blow out cheeks? Can you raise your eyebrows? And close your eyes real tight. Alright, okay, so that was testing for your cranial nerve. Is that it?
Mm-hmm.
Yeah, cranial nerve. And it seems to be in good condition. So now I'm going to palpate the temporal arteries for elasticity and tenderness, okay? So, let me know if you feel any tenderness. Nothing?
Nope.
Okay, she's got good blood flow, and now I'm going to be checking her, mandibular joints, temporomandibular joint. Okay. And open and close. Alright. Good. Okay. So, symmetrical, they were able to do all the expressions, so that's good. The temporal arteries are in good shape. The temporomandibular joint was good. Okay, now I'm going to inspect your eyes, okay?
Okay.
So I'm going to inspect the external eye. It's clean, moist. There's no crusties, which is good. So now I'm going to check your pupillary reaction to light, okay? So I'm going to use this light. Just look straight up. Don't close your eyes. I'll be quick. Alright, good. Now both pupils are around reactive to light. Now I'll test for accommodation of pupils. So again, look straight up. Follow my pen. Okay, good. Alright, accommodation is normal, equal bilaterally. Now I'm going to check your ears. So I'll be checking the auricle? Yeah. I'm just trying to figure out how to say it. Tragus, lobule, and auricle?
Mm-hmm.
Okay.
Auricle.
Alright.
I think it depends where you're from, too.
Do you have any tenderness at all?
Mm-mm.
No? Okay. So same, thing. Skin's normal, pink, not sweating. I don't see any lesions or wounds or anything on the ear, so we're good. Now I'm going to inspect and palpate the external nose. So just from looking at it, it looks good. And it's the same color of the skin. I'm going to palpate it. Alright, there's nothing abnormal. Okay. Now I'm going to include one of your nostrils, and I'm going to be checking for airflow in each nostril, okay?
Okay.
So I'm going to close this and just breathe normally, okay? Okay, good. Alright, left nostril has good airflow. Now we're going to do your right. Take a deep breath. Okay, that one has a little bit of deep decreased airflow? Are you congested?
A little bit.
Okay.
Just here.
Alright. So she has good airflow, didn't report any pain. So we're going to move on to the mouth and throat. I would inspect the lips, teeth, gums, and buccal mucosa, as well as the hard and soft palates, uvula, tongue, and tonsils. For the purposes of this video, I'm not actually going to dive in that. And I also won't check for gag reflex, because there's no reason, because you can eat. Right?
Yeah, I did this morning.
Alright. Okay, cool. Alright, now we're going to check your range of motion of your neck. I would be inspecting the neck. I'm also going to pull up your skin just a little bit right here on your collarbones. I'm checking for hydration. So your skin recoils almost immediately. So that means you're pretty hydrated. So can I have you sit up and hang your feet off the side of the bed?
Yeah.
Okay, we're going to check range of motion of your neck. So look to your right, all the way, all the way. Left, all the way. Okay. Now drop your head back as far as you can. Okay. And then look forward until your chin is touching your chest. Okay, perfect. She has normal range of motion, about 45 degrees each way. Next, I'm going to palpate the lymph nodes, trachea, and thyroid gland. So, alright, good. Now, I didn't palpate any swollen lymph nodes or your trachea or anything having to do with like a swollen thyroid or anything, so that's good. If they were enlarged, I would auscultate for any bruits, and then I would also palpate and auscultate the carotid arteries. Alright, so I'll be checking one carotid artery at a time. Oh, you listen first?
I think so.
Oh, you're right. You're right. Okay. Scratch what I just did. Okay, so I would listen first before palpating, because palpating can change the blood flow and you can't hear it as well. Thank you. Clean my stethoscope. Oh dang, yours is strong. Cool. Okay, sounds good. Now I would palpate. Yeah, strong.
I'm alive.
Yeah, for sure. Alright, now we're gonna check or move on to your hands, arms, and fingers, okay? So, I'll just check the upper extremities, just feel for any differences in the arms at all.
It's the middle finger. Do you feel a difference? Very slight.
All right there. Ah! Have you gotten that checked out?
No.
Oh, Rachel.
It's just a little cyst.
From
It
what?
used to be bigger.
Oh my god.
It popped up when I was waiting tables and carrying like really big
Really
trays.
heavy.
Yeah.
Oh my gosh.
You might want to document that.
Yeah, I will. Patient waited too many tables and now has a cyst under her middle finger. It's crazy. Okay.
Yeah, it used to be bigger. It used to be like, you used to be able to like see it.
Was it like on the surface?
Mm-mm. It was always underneath, but it used to be bigger.
Oh. Okay. We're gonna have you shrug. And turn your head against the resistance of my hand. Weak. I'm kidding. Alright. All the way. All the way. Okay. Okay. So that's checking for the spinal nerve. So good. You were able to do all those things. It's intact and good. Okay, now I'm going to palpate your hands and arms. Okay. Which I feel like I already did, but...
Good measure.
Yeah. Okay. Good. No differences other than the cyst. I'm going to check range of motion of your elbows, wrists, and fingers. Okay. So, bring your elbows. And bring them out. And then we're going to have you put your hands up with your fingers together. Spread them open. Okay. Close them again. Make a fist. Perfect. Do this again. Put your thumbs over it. Good. Okay, now put your arms out and tilt your hands. Okay, and your wrists. Good. Good job. Okay. She has good range of motion of her elbows, wrists, and fingers. At this point, I would palpate the brachial and radial and ulnar pulses. Okay. Do we have to do these at the same time?
I do.
You do?
So
Okay.
you can compare each, or you
Right.
can do them individually.
Okay.
But I think it's harder to compare when you do it individually.
Yeah. Okay. Brachial, ulnar, and radial pulses are equal bilaterally. So that's good. We're going to test sensations in your hands, arms, and fingers, okay? So go ahead and close your eyes. And let me know where you feel any sensations at all.
Left palm.
Okay.
And right middle finger. Right forearm. Left bicep. Right thumb.
Okay.
And left pinky.
Good job. Okay. Now I'm gonna go ahead and check your posterior and lateral chest. So swing your feet over and stay sitting up for me. I'm gonna expect the scapula and the chest wall. So good, nothing's protruding. Alright, now I'm gonna be checking the accessory muscles while she's breathing to see if anything's abnormal in that area. And palpate and auscultate the posterior chest. Okay. So I'm going to go ahead and listen to your chest, okay? Just take deep breaths. I'm going to listen to 10 sides, okay?
Okay.
Okay, good. Then I would palpate. Let me know if you feel any tenderness or pain. Okay, you can go ahead and lay it back now. Alright, I'm going to be inspecting your chest now. I would note the quality and pattern of respirations, observe intercostal spaces, palpate, percuss, and auscultate anterior chest, and check skin for mobility and turgor. So I'm not going to have her take her shirt off. I'm just going to listen to the chest. And I already checked for turgor and skin and all that. Okay. Okay, your chest sounds good. They also want me to, in this assessment, check the breasts for symmetry, color swelling, nodules, ulcerations, any abnormalities in general of the breast, but you're not taking your shirt off. Now I'm going to listen to your heart, okay?
Okay.
I'm going to listen to 5 spots, okay? This one's your aortic, pulmonary, herbs point. Which one's this one? I need to know this for the test. Tricuspid, and then mitral. Cool. Alright. Heart sounds good. It says it right here. Aortic, pulmonary, tricuspid, and apex. Okay. Now we're going to move down to your abdomen, okay?
Okay.
So I would visualize the stomach split up into 4 quadrants, and listen and assess for color, symmetry, contour, bowel sounds, vascular sounds, friction revs, and then I'll palpate after I listen. Okay, so there are active bowel sounds in all 4 quadrants. Palpating now. Oh god, that scared me. That's your belly button ring. It's like, what the hell?
Sorry. It's body modification.
Patient has a belly button ring. Check that. Okay. Didn't feel any tenderness. Patient reported no pain. Everything's good in that department. We're gonna move down to your leg, feet, and toes. So let's see. I'm not gonna have you take your pants off. So I would just, if this was in the hospital in the real setting, patient would be wearing a gown. We would just lift that up and check for even muscle and hair distribution. We would palpate the legs, feet, knees, and ankles. Check capillary refill in the toes. Okay, so patient would close their eyes and I would touch one of their toes and see if they can identify which ones I'm touching. Alright, Rachel, do you think you could lift your legs up and down? Okay. Alright, good. I'm going to have you sit up one more time. Dangle your legs over the bed. We're going to do a heel to shin test, okay?
Okay.
So lift one of your legs up, and I'll hold it. Now take the heel of that other foot and follow it with the shin of this foot. All right. Good. All right, let's do it with the other one. Okay, good job. Patient was able to perform a heel to shin test. While I was assessing your back, posterior, chest, everything like that, I would have checked for spinal curvature, scoliosis. Real quick, I want to observe your gait, so do you think you can hop out of bed for me?
Sure.
Okay, good. Just walk in a line. Walking around. Okay, good. Patient has good gait. All right. Now, we're gonna do a quick tandem walk. So it's kind of like when you get pulled over, and having you do a sobriety test. You're gonna do one foot in front of the other in a straight line. Okay.
Okay.
All right. Good. Patient is sober. Alright, that's good. Thank you.
Yep.
Now I'm going to do a quick Romberg test. So just stand straight, close your eyes. I'm going to push you and see if you can recover from that, okay?
Okay.
See if you, oh dang. Rock. Okay. Good. Gosh. Alright. Good. Now you can go ahead and have a seat again. We're going to do a finger to nose test, okay?
Okay.
So I'm going to put my finger up. I want you to take one of your fingers and touch your nose, and then immediately touch my finger as fast as you can. Now switch hands. Okay, other hand. I said nose first. Okay, good. All right. Now at the end of all this, you would do a full assessment of the genitalia, only if it's indicated by health history or admission diagnosis. So we're not going to do that. Okay. Yeah. I think that's everything. Did I forget anything else? No. All right. Thank you, Rachel. You can go ahead and lay down. I'm going to put the bed in the lowest position. Take gloves off, perform hand hygiene, ask you if you need anything else. Do you need anything else?
Can you pass me my water there? Thanks.
Okay.
That's it. Good to
That's
go.
it. Alright. I'm leaving the call light right here. Taking gloves off.
Thank you.
You're welcome. Performing hand hygiene.
Excellent.
Trash. Alright, goodbye.
Goodbye.